The federal government is paying compensation to hundreds of Australians who have vaccine injuries from the COVID jab. 3,501 people have applied for vaccine compensation, and this out of the 66 million vaccine doses given. Some of the COVID injuries include life-altering heart inflammations, damaged capillaries, and autoimmune disorders. There are also thousands who've applied for compensation and are waiting to hear back. Joining me now to discuss is former Deputy Chief Medical Officer Dr. Nick Coatsworth. Nick, great to see you. Now, even a discussion about vaccine injuries was something governments weren't comfortable having. Now they're actually paying compensation to hundreds of people. How prevalent are vaccine injuries in the community?
Sharri, we've got to remember that when I was up there in front of the press conferences and getting on those ads, it was made clear to the Australian people that there would be a compensation scheme because there were at the time unknowns about the vaccine. So that compensation scheme's been on the table since the vaccine rollout occurred. Now, the number of applicants, as you say, is in the thousands and the number of vaccines is in the tens of millions. So that does give you an idea of the safety of the vaccines. I still firmly believe that these are safe vaccines to have. The challenge that we have, though, I guess, as a medical community and with the TGA as the regulator, is when you define only a very narrow scope of conditions that would be eligible for the compensation scheme, there may be some people who have had injuries due to the vaccine that don't meet that narrow definition that are then left without. And that's both an extreme challenge for the individual. It is also, to be honest, a challenge for the medical community and the regulator to try and make sure that those cases are reviewed in sufficient detail. But what I want to see is no delays. I think that, I was up there as a government official suggesting that this compensation scheme would be available, and it doesn't matter if it's a Liberal or a Labor government. We had a once-in-a-lifetime pandemic, and we need to crack on and get those claims assessed. There's no reason in 2023 that we shouldn't have that all done.
Yeah, and there are thousands who say that they are waiting to hear whether their request for compensation has been approved. This is being blamed on processing backlogs. Now, Nick, I want to ask you about the study of genetics. This is really fascinating. It's on track to help personalise mental health medicines for people with psychiatric disorders. There's a belief that the brain tissue can help diagnose the mind. Nick, do you think this is worth pursuing or not?
100%. I mean, Sharri, this is the future of medicine. We call it personalised medicine, and basically the idea is that you take thousands, maybe tens of thousands of individuals who suffer from a particular condition, in this case mental health conditions, and you analyse their DNA to see if you can pick up common threads or common sequences of the DNA that are shared by those individuals with a certain illness. Now, once you've done that, you can then start to match the different treatments that we've got available with the particular different types of gene sequences that are out there and work out which treatments are best for which gene sequences. Now, mental health it's an incredibly difficult and fraught place for doctors and patients, and treatments are often tried in sequential fashion because we don't really know which one's going to have the best effect, particularly when it comes to pharmacologic treatments. Now, I think this is really exciting. It is the future of medicine. Unfortunately, it's not just around the corner, but I think within the next 5 years, we'll see some exciting developments.
Speaking of the future of medicine, AI, artificial intelligence, chatbots, they're already in the workplace. But now you think we should also use it to diagnose patients, or sort of AI doctor. How would this work?
Well, we have to embrace this, Sharri. ChatGPT, although it's not perfect, I was using it the other day. It's a very powerful tool when you put in certain symptoms, and it generally spits out a list of diagnoses of which one is likely to be correct. So if we don't embrace this as doctors, I think we're going to have trouble with the therapeutic relationship, because literally there are going to be people, particularly more young and tech-savvy people, coming to us as clinicians saying, I've asked ChatGPT or Dr. GPT or whatever it ends up being called. So we've got to embrace it. We've got to learn how to use it.